and welcome to Picture of Health. I'm your host, Linda Pilkington, joined again by Dr. Joy Jackson, the newly appointed director of the Florida Department of Health in Polk County, to continue our discussion about obesity. In case you missed last month's episode, 37.6% of adults here in Polk County are obese, compared with a state average of 27.2%. Today, we're going to find out about how to make lifestyle changes to improve our overall health and well-being. Thank you again for joining us, Dr. Jackson.
Glad to be here. Thank you.
Now, to continue on with our discussion the last time, one of the things that I think a lot of people have a misconception about is that obesity and economic status are somehow linked.
Well,
what do you say to that?
The Centers for Disease Control indicates that in males, the incidence of obesity is actually at a little bit lower in higher economic class men. In women, it's the opposite. But there's not a dramatic difference in obesity rate between the economic levels. It's pretty consistent. We have an obesity issue throughout all socioeconomic classes.
Oh, okay. Yeah, because, from my own observations, I have friends who are in the higher level in terms of economic status, and I see some of them having a problem with obesity.
Right.
And then I also see in other areas of my work that I observe that there are some people in the lower economic status who also have problems in obesity.
Yes.
So I think it's really from
quite prevalent
in every stage or
Yes.
in all the economic status. Now, are there some things that that obesity affects people in terms of their mental health?
Yes, it seems as though folks who are obese have a higher incidence or risk of mental health disorders such as depression, anxiety. They tend to have a lesser satisfaction with quality of life. They may experience more aches and pains and sleep disorders. Now, that's not to say that everyone who's obese experiences these, but when those who are heavy are asked, they do have a higher incidence of these mental health disorders.
Do you think this is attributed to the way they look at themselves?
I think that's part of it, and part of it probably is also how they feel. If you get up and you try to walk the stairs and your knees are hurting.
Right.
So I'm sure part of it is image and also the way they physically feel.
Now, in a lot of my readings, you get bombarded with so many things on TV, magazines, and on the internet. And they said that water is a very good way of helping people control their weight. What do you think about that?
I think that's true to a certain extent. I think water, frequent sipping of water does distend the stomach and make you feel more satisfied. It's also a zero-calorie option to help stave off hunger, so I think it's a good thing to partake. And most adults, depending on their activity level and how much they sweat, should consume about 8 glasses of water per day.
Okay. Now, what do you think? This was a long time ago, and I heard from somebody that the first thing in the morning that you need to do is take a full glass of water, not cold water, but I think water at room temperature with 2 tablespoons of lemon. And they said that it would help in terms of controlling your weight. Is that?
Well, that's an interesting thought. I've not heard about the lemon twist, so to speak. But clearly when we get up in the morning and we've had presumably nothing to eat or drink for 12 hours, and you've been recumbent, so a lot of the fluid in your legs has been absorbed, it is a good time to consume liquids, and that would be a healthy time to do that.
Okay. So before taking anything else, so you think it's a good idea to drink some water?
I think it's a good idea. Yes, I think it's very reasonable.
All right, great. Can you explain, like people are always talking about counting calories. Now, is there a difference in terms of, let's say, taking a chocolate bar of 100 calories and maybe fruit of 100 calories?
Good question. 100 calories is 100 calories from the standpoint of the amount of energy that it provides your body. The problem with sweets is that the calories are sugar and fat. 100 calories of fruit or vegetables also includes other nutrients, it includes fiber, and includes water. So it's much better for you to have those calories come from a food that provides other nutritional value.
Right. So in terms of snacking, like let's say, for example, okay, you can have 100 calories for a snack. So you would recommend for them to have maybe some vegetables that equals to 100 calories rather than potato chips
Absolutely.
that equals to 100
right.
calories.
And vegetables, you know, particularly those that expand, actually make you feel more satisfied because they take more room and stretch your stomach out better. And that's a much better nutritional value than a snack like potato chips, which is also very high in sodium and other chemicals that we may or may not even know are in some of the fast foods and fast snacks.
Now, does sodium have to do a lot in terms of people gaining weight, or is it because they're gaining more water as opposed to, you know?
Now, we have amazing organs in our bodies called kidneys, and if we consume excessive sodium, you will absorb extra water from your GI tract to balance out the sodium. And then over time, minutes to hours, you will excrete both through your kidneys. So the kidneys clear the extra salt and the extra fluid. So yes, you may temporarily, you know, if you eat something, a
Really
meal high in
salty.
sodium, you may temporarily gain weight related to fluid retention. But if your kidneys are healthy, you will clear it.
Okay. Now, what is your take on putting children on a diet?
Well, we know statistically that about 1/3 of American children are overweight or obese, which is an astonishing statistic. Right. Over the past 20 years, our children are getting heavier. What we would prefer to see are children that are mentored and taught healthy living habits when they're younger to help prevent overweight and obesity from occurring. And it takes a village to teach children how to live healthily. It involves the families, the school, healthcare providers, and all of us. If a child does gain excessive weight, I think it's very important that these children and their families work with their healthcare providers for a safe way to lose weight.
Now, in terms of what we're doing in the state now with the Commissioner of Agriculture basically taking over the provision of meals in the schools, what do you think about that?
I think it's excellent. Again, you know, if you think about it, a lot of a child's consumption of food occurs at the school.
Right.
And so for children to have options of healthy foods is very important. Not having sugar-sweetened sodas available in machines is very important. And there's a lot of messaging going on in school systems around the state regarding 5210, which is 5 fruits and vegetables a day, 2 hours or less of recreational screen time, 1 hour of physical activity, and 0 sugar-sweetened drinks. And this is a concept that we're also utilizing in Polk County from WIC through the school system to pediatricians. So it's a very valuable, and these are simple messages that can be taught and learned through everyone in the community.
Okay. Let's take a quick break to see what nutrition tips Whitney Fung has to offer us this month from the IFAS division of the University of Florida.
Hi everyone, my name is Whitney Fung and I'm with the University of Florida IFAS Extension Service in the Indigent Healthcare, which is funded by the Board of County Commissioners half-cent sales tax. Today we're going to talk about My Plate. We went over the overview last time, and today we're going to talk about the 10 tips to make a great plate. And so we'll briefly go over each of those tips, but in future sessions we're going to talk about each of them in detail. So the first tip is balance your calories. What are calories, right? Calories is just another form, a measurement of energy. And so an average American needs about 2,000 calories per day. So in a whole day's worth, you get 2,000 calories, but it's different for each person, and we'll talk about that in the next session. But you want to balance them, not eat too much, because then you can gain weight. Number 2, enjoy your food, but eat less. We all love food, right? I wouldn't want to cut out any food that I want because we want to enjoy it and we want to be happy. But we don't need that overfilling bowl of food and eat too much. So we want to make sure you enjoy your food, but eat less. Number 3, avoid oversized portions. And for My Plate, you use a 9-inch plate. So you don't want it to be a huge platter. You know, if you want, you can even use a small plate. It takes your brain about 20 minutes to realize that you're full. So if you scarf down your food really fast, then you can end up eating too much. So you want to avoid oversized portions. Tip number 4, foods to eat more often. So we want to focus on more of those vegetables, fruits, whole grains, and fat-free or 1% milk and dairy products. And so we talked about my plate, and you want to make half your plate fruits and vegetables. So making sure you eat more of those good things, especially things that are high in fiber. So eat more of those foods. Tip number 5, we just mentioned, make half of your plate fruits and vegetables. And so those fruits and vegetables are chock full of vitamins and minerals. Eat a rainbow of colors. Vary your veggies, eating different colors, your dark green leafy vegetables, your red colored, orange colors. Eat all different types and even try something new. But you want to make your plate half your plate fruits and vegetables. Tip number 6, switch to fat-free or low-fat 1% milk. So there's different types of milks, different colors. So when you're going to the store, you'll see whole milk, 2% milk, 1% and skim milk. So anyone over 2 years old can follow the recommendation of switching to a fat-free or low-fat milk. It's hard sometimes, especially because it tastes good, right? And sometimes people say skim milk tastes like water, but take one step at a time. Tip number 7, make half your grains whole grains. And so we want to make sure we have enough grains every single day, but focusing on those whole grains. So brown rice instead of white rice, 100% whole wheat pasta instead of regular pasta, and then 100% whole wheat bread instead of white bread. And so there are different types of breads out there, but you want to make sure that you choose a whole grain, and you can check that by looking at the label, and it should say 100% or the word whole. Number 8, foods to eat less often. So they looked at the American diet, and they looked at things that we eat too much of and things that we eat too little of. And so they want us to reduce and limit foods that are high in solid fats, added sugars, and sodium. And so we'll talk about each of those and how it affects our health, whether we need them or not, and then what are the good things about them as well. Tip number 9, compare sodium in foods. We need sodium in our diet. Sodium is also your salt. The only thing is we have too much in our diet. And if you go out, eat out at restaurants, there's a lot of sodium hidden in our foods and even at the foods that we buy. So we want to make sure we read our labels and watch how much sodium we eat. Last tip is drink water instead of sugary drinks. So water, it could be free, right? Tap water, and it's also calorie free. So if you can, try to drink more water throughout the day, and then instead of those sugary drinks like your sweet tea, your coffee, your soda, energy drinks, little things like that, you want to make sure that you can try to drink water if you can. A healthy lifestyle is one step at a time, and we'll go through each of those and help you along the way as we go through these sessions. Thank you for being here with me today. Hope to see you next time.
As part of the University of Florida IFAS Extension, Polk County offers the latest research-based information packaged in a way that makes it easy to use. It's like going to the university without leaving home. Through Extension, Polk County residents find answers to both common and difficult issues in a diversity of topic areas. From lowering doctor visit frequency through better nutrition, to planting a low water use Florida yard, to protecting commercial fruit operations from pests and diseases. Find a place for your children to stay safe and build their confidence through the 4-H program, or get a license to spray chemicals as a service for your small lawn and landscape business. More than 500 Polk County youth and adults volunteer with Extension each year as 4-H club leaders and as certified master gardeners. As a resident of Polk County, I hope you'll use the opportunities through the Extension service to learn more to apply to your life, home, business, and community.
Welcome back. If you are just joining us, we are here today with Dr. Joy Jackson, the Director of the Florida Department of Health, to discuss obesity and how to make healthy lifestyle changes. Welcome again, Dr.
Thank you.
Jackson.
Thank you.
Can you talk about the different food that is either good for you or bad for you? I mean, there has been a lot of things written about dairy and whole milk and about eggs and red meat. So what do you think about that? And what can you tell our audience in terms of how to choose the food that is good for you?
Dairy products are very important for development of our children and for adults. Dairy products contain calcium and vitamin D, which are very important for bone development and electrolyte and metabolic function. However, we do recommend that folks consume low-fat type of dairy products. And these include milks and cheeses and yogurts and that sort of thing.
Do you think that the fat-free milk would be better than the 1% or the 2% milk for
Yes.
children?
Well, very young children actually should not be on fat-free because they do need some fat in their diet for brain development and neuron development. So there is some fat needed. I would suggest that parents talk with their pediatrician as to what age they should go to a lower fat milk. Other food items such as beef, small amounts of beef, up to 5 ounces a day of lean beef is probably acceptable. Foods such as fish are very high in omega fatty acids, which are very good as a good source of fat that's very healthy. The types of fats that we need to try to avoid are saturated fats and trans fats. And these are the types of fats that are found in predominantly red meats. Trans fats, as you probably have heard, have been pretty much banished from a lot of fast food organizations, and they chose trans fats because they're easy to cook with and they don't spoil very quickly, but they had very negative impacts on folks' cholesterol levels and LDLs. So that's in a nutshell. We again recommend diets that are high in fruits and vegetables, and only about 30 to 35% of a diet related to fat.
Okay. So basically, red meat, we need to try and limit our consumption of red meat.
Right.
But how about pork? Because they say that pork is the other kind of meat that, you know, some people are recommending to get their protein from.
Well, pork is a very good source of protein. I think it's naturally a little lower in fat, but again, not having it excessively, and the barbecue sauce that we tend to like is not a good additive to pork. So I think most things in moderation are acceptable.
Okay. So basically, if you look at the different food groups, you know, and you make sure that you have a little bit of everything, and utilize the different kinds of food in moderation, then you should be in good shape.
That's part of the story. The other
Right.
part is exercise.
Right. But what about for people who are obese? I mean, how do they balance, you know, what is better for them in terms of what they eat?
Well, for all of us, we maintain our weight when the calories in equals the calories that we consume with exercise. We are all unique in how we respond to exercise and movement. You know, I've got friends that could eat a tremendous amount of food and they don't gain weight, and I can eat small amounts and I feel like I do gain weight. So to get to learn your own metabolic style is important, but the one common factor is that your weight is based on two things: how many calories you consume and how many calories you expend with exercise.
So let's say, for example, that somebody is 150 pounds, and what the guidelines are for the height and the age of this person, they have to be at least 130 pounds. So they have to lose 20 pounds. Now, how can they determine how much exercise they need to do? Do they need to consult with an exercise guru, you know, to show them what to do? Or is there a way for them to determine, you know, the regular people? Is there a way for them to determine how much activity they need to do on a daily basis?
But it's generally recommended that a healthy adult to get about 2 hours of moderate physical activity per week or about an hour and a quarter of more strenuous activity. Moderate activity can include a brisk walk, which would be the equivalent of a 15-minute mile. It could include yard work such as raking, mowing the lawn, casual bicycle riding, or playing with the kids. Those are viewed as moderate activity. And with those, you'll consume between 150 and 180 calories every 30 to 60 minutes. Again, partially depending upon how vigorous you exercise and what your metabolic rate is. More extreme exercise, such as running or jogging, swimming laps, competitive sports, those are also excellent. But for folks who haven't exercised much in the past are more at risk of injury. So we recommend you start slow and increase as tolerated. Whether you utilize an exercise expert is really up to the individual. The key is making the exercise part of the routine so that you will do it consistently.
Yep. And I think that's very important, because if you only do it sporadically, then it's not really going to help you in the long run. So how many days do you think is should somebody exercise on a regular basis out of the week?
Well, it's hard to say how you get your 2 hours in. Right. I think ideally, if it's possible to exercise at least 3 times per week, go out and take a stroll after dinner. Mm-hmm. But we all, for those of us that work and we're very busy and we've got families and other commitments, sometimes it's difficult to piece it together unless you make it part of a routine. And one key tip is after supper, mm-hmm. rather than turning on the television, you go out and take a 20-minute walk. And if you did that 3 or 4 times a week, you will be doing very well.
And I guess in Florida, the best time to walk or to do some kind of activity is after the sun sets, because it's so hot.
Yes, just be sure to wear your DEET so you don't have mosquito exposure.
That's right, yes. Let's take a look at the Indigent Healthcare Dental Program. We will be right back.
That there is one dentist for every 4,000 residents in Polk County, and that is worse than the state and national average. So obviously that identified the need to start looking at dental more closely and identifying ways that we can increase that access for our low-income residents countywide. Because Polk County has this dedicated half-cent sales tax, and it's used for matching funds for different grants and other opportunities. We definitely want to provide more outreach and education to the community, because there's definitely a need for it. But we also want these people to be able to get that preventive care and get the treatment and services instead of going to the emergency rooms. Because at that point, that's when the costs start adding up and those emergency rooms become full of patients needing treatment for dental. And it could be non-emergent situations. And so what we want is these patients to go somewhere where it's not an emergency, where it's not going to be costly and extremely expensive for them to receive that care, and they'll get the right care in the right setting at the right time. I am extremely happy with the fact that we've got so many agencies coming together. We've got nonprofits, private businesses, educational institutions, coming together to figure out ways that we can start partnering to be able to see more people and to provide more services to more people.
And this is our newest facility. And then we have 3 other ones. We have one in Bartow, one in Auberdale, and one in Lakeland. We provide services, both preventative services like cleanings and x-rays, and then we provide surgical extractions. We provide fillings for adults and children. Children has always been a primary focus of ours through prevention efforts. But over the last years, we've realized much more of the need for adults for dental care in this county, and that's why we've expanded our services. Well, we serve lots of different kinds of people. People who need to pay cash, people who have Medicaid, and then we have some grant funding that provides some services for adults. A gentleman who made a phone call one day and said he had not had dental care most of his life. And he came into one of our clinics, and they took care of him with a series of extractions. And he called me twice to be sure I knew of what a positive experience it was, how he now didn't mind going to church on Sunday, he could now eat, and that he just felt like he was so thankful that there was now a program available for him. That makes me smile.
When we started the clinic here, our objective was to get the students with more hands-on clinical training, actually in a dental office with a dentist, as well as to treat the individuals in the community that needed dental care. So it was a twofold ambition that we did there. And then getting the patients to understand that we are only open January to May. We're only open 2 days a week, Monday and Tuesday. There is quite a waiting list, and we will get to you as soon as we can. Our first objective, obviously, is to train our students, to make sure that our students, when they graduate, are ready to walk into those private practices and be dynamite assistants for those practices. That's our first objective. Then our second objective, obviously, is to make sure that we can treat those that are most in need for dental care in the community that otherwise would not be able to afford to go anywhere.
Lakeland Volunteers in Medicine is a clinic for the working uninsured of Polk County. We provide medical services, doctor's visits, dental care, mental health services, laboratory, x-ray, and pharmaceutical services for those that don't have health care insurance and live in Polk County. And we provide full service from pain relief to extractions to treatment plans, where we'll take the patient all the way through everything they need done with their teeth. We also have volunteer dental hygienists, so we offer the hygiene services and cleanings here too. We're working with the Polk County Healthcare Plan. They are coordinating a pretty significant outreach as far as bringing everyone together. Lakeland Volunteers in Medicine, Travis Votek, the Polk County Health Department, and in any other clinics that have the ability to do dental, and bring those together in some coordinated fashion, and to see if we can then serve more patients in Polk County.
And it's affordable. It's a beautiful place for anyone that don't have no insurance. This is the place to be and the place to come.
Service is wonderful, the doc's great, and I kind of enjoy coming here.
Today I had broke my teeth like last week, and look at me now. I'm back smiling again. Thank you.
That is heartwarming to know that they can come here and get care and feel good about the care and trust us, and especially to know that they're going to come back and that we're going to be their patient-centered medical home for dental and for medical services.
We're figuring out ways to address the needs of our population. We're not waiting for the state, we're not waiting for the federal government. We're coming together as a community, and we are looking at providing services to our vulnerable population and taking care of them.
Poor dental health has been linked to heart disease, cancer, and a shorter lifespan. Your mouth and teeth can't function independently of your body, so to stay healthy, avoid alcohol-based mouthwashes. They can dehydrate your mouth, which needs moisture to wash away bacteria and neutralize acid. Avoid sucking on lemons as well as chewing on ice, and consuming sugary foods and acidic drinks like sodas to prevent decay. Also manage your stress, which can cause dry mouth, teeth grinding, and inflamed joints. And lastly, to help prevent gum disease, exercise daily to improve your circulation and immune system. For the Health Reporter Minute, I'm Karen Owak with your quick dose of health news.
That's all we have for today's episode of Picture of Health. Dr. Jackson, thank you so much for your invaluable knowledge and expertise.
You're welcome. Enjoyed being here.
Thank you for joining us. I'm your host, Linda Pilkington, and I'll see you next month on Picture of Health.